In this video lesson, we'll be covering a nurse care plan for the nursing diagnosis of impaired cardiovascular function. We'll cover its definition, defining characteristics, related factors, expected outcomes, ongoing assessments, and therapeutic interventions. By the end of this session, you'll have a clear framework for managing impaired cardiovascular function. Vital Nursing 101, your ultimate guide to nursing success. Understanding the diagnosis. So what exactly does impaired cardiovascular function mean? It refers to a potential disruption in the heart's ability to pump effectively or in the vascular system's ability to maintain adequate circulation. Common related factors. Some of the key factors that may increase the risk include advanced age, history of hypertension or hypotension, diabetes mellitus, obesity or sedentary lifestyle, smoking or excessive alcohol use, and stress or anxiety. While this is a risk diagnosis and does not have actual defining characteristics, we monitor for signs such as changes in heart rate or rhythm, altered blood pressure trends, shortness of breath or fatigue on exertion, peripheral edema, and cyanosis or cool extremities. Common expected outcomes. The primary goals for patients at risk for impaired cardiovascular function are the following. Maintain stable vital signs within the patient's baseline. Demonstrate adequate tissue perfusion evidenced by warm extremities, normal capillary refill, and absence of edema. Report absence of chest pain, dyspnea, or palpitations. Engage in appropriate lifestyle modifications to reduce risk factors. Here we will go over the ongoing nursing actions and why they are done. Monitor vital signs. Regularly monitor blood pressure, heart rate, respiratory rate, and oxygen saturation. Vital signs provide critical insight into cardiovascular function and help identify early signs of deterioration. Assess for symptoms of decreased cardiac output. Monitor for symptoms such as dizziness, fatigue, shortness of breath, or changes in mental status. These symptoms may indicate compromised perfusion or early cardiac dysfunction. Evaluate laboratory and diagnostic results. Review lab values like troponins, BNP, lipid profiles, and diagnostic tests like ECG or echocardiograms. These values help detect myocardial injury, heart failure, or underlying structural issues. Now, let's go over therapeutic nursing actions and why they are done. Educate on lifestyle modifications. Provide education on maintaining a heart-healthy diet, increasing physical activity, and avoiding tobacco or alcohol. Lifestyle changes significantly reduce cardiovascular risk factors, improving overall heart health. Administer and monitor medications. Administer prescribed medications such as antihypertensives, anticoagulants, or statins and monitor for side effects. Medications help manage risk factors like hypertension, hyperlipidemia, and thrombus formation, preventing complications. Promote early ambulation and activity. Encourage progressive ambulation and mobility tailored to the patient's tolerance. Early ambulation enhances circulation, reduces the risk of venous stasis, and improves cardiac efficiency. The nursing diagnosis of risk for impaired cardiovascular function requires vigilant assessment, goal setting, and evidence-based interventions. By monitoring vital signs, educating patients, and promoting lifestyle changes, we can significantly mitigate cardiovascular risks. All right. Well, that ends this nursing review. If you found this video useful, leave a like and a comment so we can continue to make more videos like this. Also, if you have any study tips, leave them below. I'd love to hear from you.